All right, y'all, time for your health check. North Texas really is trying to strike a balance to reopen businesses and also keep everyone healthy. But more people are being hospitalized with COVID-19. Joining me now is Dr. Mark Casanova, president of the Dallas County Medical Society, here to answer your questions. Good morning, Dr. Casanova.
Good morning.
So we know about this uptick in cases. We've seen higher numbers. Are there any surprises there, really?
No, we did anticipate that as we loosened restrictions, we would see an increase in positive cases. What we're disheartened by is the increase in hospitalizations. It's for those reasons, as we get back out into the community, that we need to bear in mind that these are our tickets to freedom. Okay, hand washing, face masks, and maintaining physical distancing.
Okay, I've got a question from Stan, who's asking, what do we know about false positives? Is there any data around that, particularly, of course, when we're talking about testing, and maybe this is a good time to distinguish the difference between diagnostic and antibody testing?
Great question, Stan. So when we hear the phrase false positives at this time in our testing strategy, that is typically a reference to antibody testing, also called serologic testing. This is analyzing the blood for evidence of antibodies. The problem is that our current test platforms do show false positives related to prior COVID infections that individuals have had. So as of right now, it's not a highly reliable test because it can provide a false sense of security that an individual has already acquired the infection. We also need to remind individuals we do not have strong evidence that immunity or protection from reinfection is actually acquired by having the COVID infection.
I've got another question coming in from Twitter. Is there a blood type that's more susceptible to specifically hospitalization?
No, there's not a blood type that's more susceptible to hospitalization, but we do see that there are groups that are more susceptible to hospitalization. Individuals with underlying health risks, individuals with impaired immune systems, and 80% of individuals who are hospitalized who report employment are actually essential workers. So frontline individuals, whether it be in healthcare, infrastructure, grocery, supply chain. So that's really telling. Also individuals who do suffer from social determinants of health that impact their overall health. So Hispanics and African Americans.
I've got a question from a woman. She and her husband have both tested positive, but they've been testing positive. They've retested themselves for longer than 14 days. So two-part question here. How long does COVID-19 stay in the system? When are they most contagious? And also, what does it mean to have actually recovered from COVID-19?
So in terms of how long is an individual infectious, we are most infectious when we're symptomatic. So there have been case reports of individuals testing positive for a prolonged duration, greater than the average 2 weeks. The feeling is that their chance of spreading that virus is low, but they would obviously want to be mindful and be very careful about exposure to others. Recovery from COVID is simply a term that implies an individual has recovered from the infectious aspects of the virus, the cough, the fevers, the chills, nausea, vomiting, and diarrhea, and they are essentially feeling back to normal. That is what we refer to as recovered. For many individuals, that's approximately a 2-week time frame, but there are others that it is longer.
Yeah, and recovered or not, antibodies or not, we really don't have an idea of how long immunity lasts at this point, remembering that this is still, of course, a very new virus. And as you showed us at the beginning, those masks, hand sanitizers, washing your hands, that's really going to be the key for all of us. Dr. Casanova, thank you so much for your time. We appreciate it. We're going to keep this conversation going as well.